Hi, this is Ashley from Tranquil Therapy, and this video is all about the theracane. The theracane is a light piece of plastic that you can kind of take around with you anywhere, clip it onto your backpack, that kind of stuff. Very versatile. This is a tool that I've been using for over 10 years now. This you can use literally anywhere alongside of your body, and so make sure that while you're using this, if at any point in time you feel any shooting pain, tingling, synesthesia going down the arms or anything, that you stop and readjust. If you are having issues when it comes to any inflammation, or if you're taking a medication that thins your blood, please use this with more caution and just check in with yourself and make sure that you're breathing throughout these exercises. Breathe in when you kind of find a good spot, and then breathe out when you're applying the pressure. Okay, let's get started. So this exercise is an active neck exercise for the theracane. What you're going to do is find the little shelf here. Show you on this side. There's like a little shelf where your shoulder and your neck meet, and that's typically where we get a lot of achiness, pain, pulling, tightness, that kind of thing. So whatever side you're on, that hand goes at the top. That's going to stabilize the theracane. The other hand goes at the bottom so that you can get the pressure that you want. Now, how you can tell if you're on the right spot is kind of feel around in here, and then you're just going to kind of bring your ear to your shoulder and like, okay, that's the spot. And then what you're going to do is continue to do that. While pressing in and down, you're going to go ahead and just move your head from side to side, and then down and up. Whichever one feels like it's doing the most work for you, you can also just do both. So what happens when you do an active exercise like that is the muscles are pinned and then stretched. They're forced to move, which allows the muscle to release quicker than if you just were to kind of go to town on the one area. The next exercise that we're going to do is kind of like an occipital one. So after you kind of get in all of this, you're going to go ahead and you want to get the top of the neck here. So with that, you're going to take whichever side you're not working on and put the hook side there, and whatever side you are working on, you're just going to grab the bottom part of the theracane so that when you come up, you can use either one of these, whichever one feels best. I'm going to go with the top one. And you're just going to kind of go right in through here. And this, you can tell you're on the right spot just by looking down. You'll feel it stretch. And here, you're just going to kind of hang out, and you're just going to make sure that the opposite side is the one that's giving the pressure. The side that you're on is always just guiding it and stabilizing it. You can move around a little bit if you'd like. But for the most part, you just want to kind of stay in one spot. So another thing that you can do is go ahead and go along the side of the shoulder here. So you're just going to get right on the outside of where your shoulder is. Not quite up here where the shelf is where we were working before, but right along this area, like the outside of the scapula area into where the arm actually meets the shoulder and upper back. And you're just going to kind of go and dig in through that area. Again, pressure on this side, stabilizing on this side, and just kind of follow the bone down into the back. Another way that you can get into that area, and it's a little bit trickier, is you can actually go inside the armpit. So you can bring your arm up, just kind of rest your fingers on the neck here, and you're going to just find a spot for the shoulder or for the armpit in here, grab the top, stabilizing, and you're going to press in with this. And you can get underneath in that area. Now, it's not as great as doing this side because this one you can really control where you're at. However, if it feels like it's on the inside of the armpit, that's a good way to reach it. The next thing we're going to do is get underneath of that scapula. So the scapula is that wing bone. It's like the L-shaped thing that's on your upper back. It's always causing you issues and problems, and a lot of people say, it's right in between my shoulder blades. So we're going to get there. How we're going to do that is, again, the same thing. We're actually going to stabilize with the same side and use the opposite side to push. So my scapula is right about here. This is where I feel it the most. And you want to go underneath of the arm so that hook can really get in here. And you're going to stabilize here, come down here, and then just kind of go a downward motion like this. It might slip, but that's okay. And you're just going to continue to stay there. Now you can stay here, and once you have it stabilized and you have this pressing down, you can just go ahead and grab it, bring your arm out, and then do small circles. Try drawing a small circle with just your elbow, and that can get in there. As you continue to work down the shoulder blade, ooh, that's a great spot. Make little circles. And if that seems a little bit too hard, or if it's moving too much, feel free to just stay there until you feel a little bit of a release happen. You'll be like, okay, now I can try to go deeper. As you work through that, you'll be able to actually get underneath of it, like in through here by moving around. You kind of see where that kind of goes all the way in there. And that'll be a great way to get in between the shoulder blades. You don't have to be right alongside the scapula, but never go over your spine. Don't ever put anything directly on top of your spine and apply pressure. It's not good. So then the next thing we're going to do is forearms. With the forearms, what you can do is very easily get this upper part. So when we have forearm pain, it's typically in something called the pronator. And what that does is this. This is its main motion, is to turn the hand upside down or turn the hand over. So we're going to get this area right in here. And all you got to do is go ahead and bring the theracane in so that each side goes on either side of your thighs. Now, if it's a little bit too small for you, feel free to go down to where the knees are like this. But for me, it feels good right about midway. And you're going to lean into it. You're not going to use your arm to push down. You're going to lean forward with this so that you're using your body weight and not your muscles. So you're going to find the area that kind of hurts, put it right here. And what's going to happen is this is going to kind of find a little indent or along this side, because you have the ulna and the radial bone, or ulna and radial nerve. And if at any point in time you feel tingling, shooting pain, stop, readjust. Now for this, you can make a fist and then let it go. You can also point your fingers down and point back up. That's what that active exercise is that we did in the beginning. And that'll really get in there. You can also just kind of lean forward and go all along the forearm if that feels better for you. Feel it out a bit, see what works best. Now, to get the full body thing in here, we're going to go ahead and continue with that through the IT band. So what you're going to do is just take one leg out. You're going to stabilize again with that side, and you're going to be doing the pressure with the opposite side. So for here, I'm just going to go along the IT band. Now, the IT band technically is just a very small muscle in about this area. So if you want, you can kind of really get in here like this. But if it feels better to go down the thigh, feel free to do that. Again, stabilizing same side, pressure other side. And then if that kind of feels pretty good, but now you're feeling it more at the top, just use both hands and go down the top of the quads right here. Some people, however, feel it more in the low back afterwards. So all you're going to do is flip it over, and you're going to find the glute medius to start, which is right around here. You have medius, which is a little bit bigger, or a little bit higher, not bigger, because the glute max is the biggest, which is right about here, and it has all of this lower stuff in here. We're going to stick with glute medius, which is, if you're wearing jeans, right along this area. And feel free to Google some of these muscles to get a better idea of where they are. And again, stabilizing, pressing this way, and I'm just finding a good spot and staying here. If you want to increase it, you can just lift your leg up and come back down. You can also straighten the leg depending on how it feels for you. All right. Hopefully you got some good ideas with the theracane. There are so many ways to use this tool. All you need to do is mess around with it a little bit and understand proper body mechanics. Stabilization versus where the pressure goes in itself. Thank you for joining me, and I hope that you learned something new to improve the quality of your life. I'm Ashley with Tranquil Therapy. Until next time.